We are starting with genetics 2, what we have in our syllabus. In that, this is one of the topic, that is chromosomal abnormalities. So we all know what are chromosomal abnormalities. If you see, this chromosomal abnormalities often cause due to some kind of heredity, also heredity characters, and also due to some kind of a syndromes which will be caused because of the genetic disorders or anything like that. So if you see this chromosomal deletion disorders, if you see deletion syndrome, microcephaly and a large anterior fontanelle are characteristic features of this syndrome, deletion syndrome, which is known as 1p36 syndrome. So, if you see here in this syndrome, what are the effects and what it is? If you see, cardiac defects are common and dilated cardiomyopathy may present in infancy, that means in infants, and mental retardation, hypotonia, hearing loss, and seizures are usually seen because of this syndrome. Next one is, if you see, Wolff-Hicon syndrome, also known as 4P, that is the deletion chromosomal disorder. This syndrome is characterized by microcephaly, an unusual development of the nose and orbits, suggesting an ancient or other abnormalities commonly seen, including the cleft lip. That means the lips will be like a cleft will be seen, and cardiac and renal defects will be seen, and some mental retardation was also seen in this syndrome. The other one is, if you see in this chromosomal syndrome, Sky-Due-Chat syndrome, also known as 5p deletion of terminal chromosomes. So this disorder is characterized by unique facial features, like that means the facial features will be some kind of an abnormality or overgrowth or something, like retardation, growth retardation will be there, and patients have an unusual, if you see cat likes unusual like eyes also, and also the voice what they are getting, and most patients have major organ abnormalities, that means in the development of their organs it may be delayed. So if you see chromosomal abnormalities most often present in newborns as multiple congenital abnormalities in association with intrauterine growth retardation. That is, in this case, if you see, the chromosomal abnormalities are mostly present in the newborn infants, where it can be developed due to some congenital abnormalities in the intrauterine growth. Although most of the severe chromosomal abnormalities such as trisomy are lethal, some individuals may survive if the abnormality exists in mosaic form. Like you can see some examples which include the trisomy, and the cat eye syndrome is caused by the extragenital material which is derived from a portion of chromosome 22. So sex chromosomal abnormalities, if you see in the sex chromosomal abnormalities, it is the first syndrome, that is XYY syndrome. Here in this case, newborns with XYY syndrome in general are normal. Affected individuals may on occasion, it might be occurring in this syndrome, exhibits an abnormal behavior pattern from early childhood and may have mild retardation problems. And also fertility may be normal. Many males with an XYY karyotype are normal. There is no treatment. Long-term problems may relate to low because of their any internal qualities or any environmental stress. Coming to XX syndrome, the incidence of females with an XX karyotype, approximately it is 1 is to 1000. Females with triple X are phenotypically normal. However, they tend to be taller than usual. These are some kinds of things can be observed. Taller than usual and to have lower IQs and than the normal siblings. Learning and behavioral issues are relatively common in them, and this is in contrast to the individuals with this XX as much rarer condition causing more severe developmental issues also can like dysmorphic phenotype, etc. can be caused. Coming to the next syndrome, that is Klinefelter syndrome. So this is one kind of a syndrome. The males with Klinefelter syndrome require testosterone replacement therapy as the testes will be in a smaller size. So if you see here, diagnosis of this syndrome, diagnosis is rarely made before puberty, and also the incidence of this Klinefelter syndrome in newborn population is roughly like 1 is to 1000, but it is about 1% among mentally retarded males and about 3% among males seen at infertility. Coming to this, the maternal age at birth is often advanced. So unlike Turner syndrome, Klinefelter syndrome is rarely the cause of spontaneous abortions recently. So next one is Turner syndrome. Treatment. If you see this Turner syndrome, in Turner syndrome, teenage patients need counseling to cope up with the stigma of their condition and to understand the need for hormonal therapy. So estrogen replacement therapy will permit development of secondary sexual characters. If you see in the Turner syndrome, the secondary sexual characters may be in an abnormal stage or low development, and for them estrogen replacement therapy will permit development of secondary sexual characters. Females, if you see in case of females, uh, menstruation problems and also some osteoporosis problems can be avoided by the estrogen replacement hormonal treatment. Growth hormone therapy has been used to increase the height of affected girls. That means the girls might be in this type of syndrome, might be short or dwarfism. So if you see here, the if you see furthermore abnormalities involving either sex chromosomes or autosomes and congenital malformations, thus ultrasonography and chromosome analysis are indicated for the offsprings of females with sex chromosome abnormalities. Early stages can be found out. So these are some clinical findings. Newborns with Turner syndrome may have webbed neck. These are the symptoms: edema of the hands and feet, and also if you see here, later symptoms include like short stature, that means the height, shield chest and wide set nipples, and some affected girls, particularly those with mosaicism, have short stature and ammonia without dysmorphic features. If you see this picture, elaborates all the different problems. See, if you see here, the poor breast development, elbow deformity, and rudimentary ovaries, and no menstruation cycles for them, small fingernails, brown spots. If you see here, the brown spots, these are the widely spaced nipples, and shield shaped thorax, if you see here, and also the low hairline here. So these are the symptoms. So Turner syndrome, if you see here, these are the features what I described. Next, if you see, these are the syndromes what I have explained: sex chromosome abnormalities, Turner's, Klinefelter, XYY syndrome, XX syndrome. So if you see genetic counseling, most parents of, if counseling can be given for the parents, most parents of trisomic infants have normal karyotypes, and the risk of having, if you see here, the risk of having a child affected with trisomy varies with maternal age. So if you see for trisomy 21, age-specific risks are like 1 is to 2000 for mothers younger than 25 years, and 1 is to 200 for mothers 35 years of age, and 1 is to 100 for mothers at the age of 40. So these are the factors. The recurrence risk for trisomy in future pregnancy is equal to 1 is to 100 plus the age-specific maternal risk. These can be considered. And also, if the child has trisomy resulting from translocation and the parents has an abnormal karyotype, the risks are increased here. So treatment of this trisomies, there is no treatment other than general supportive care for trisomy. So if you see here, there is one more syndrome, that is Patau syndrome. Here if you see, the symptoms include prenatal and postnatal growth deficiency, although unlike trisomy 18, infants may have normal birth weight and Also, if you see here, eye malformations, cleft lip and palate, and also some congenital heart diseases, etc. are the symptoms for this Patau syndrome. This image shows the Patau syndrome. Okay. So next one is the adverse syndrome. The incidence of, if you see here, this adverse syndrome, trisomy 18 syndrome, is about some 1 is to 4,000 live births, and the ratio of affected males to females is approximately 1 is to 3. So infants with this trisomy 18 are often small for gestational age and have dysmorphic features, including a characteristic facial extremities, etc. Next, Down syndrome medical therapy. If you see, no convincing documentation still now, but genetic counseling can be avoided. That means genetic counseling can be given, and mostly it can be avoided in the infant stage or in the uterine stage or somewhere. These are the some clinical finding of trisomy 21. That means abnormalities like gastrointestinal tract or some kind of abnormalities in the minor, that means in the limbs, or if you see, it includes some kind of limb problem or cardiac endocardial fusion defects, or some kind of disorders can be seen in this. And also, if you see, this cognitive disabilities are like Down syndrome patients than in unaffected children. That means increased tendency of thyroid dysfunction, and also if you see, the affected newborn may have prolonged physiological jaundice, polycythemia, and transient leukemoid reaction. Okay, so if you see here, this picture includes some kind of a like protruding large wrinkled tongue, mental retardation, characteristics of the eye if you see here, and congenital heart disease, intestinal defects, shortened fifth finger if you see here, and wide gap between the first and second toes if you see here. So these are the certain diagnosis and typical features, which includes congenital heart disease and also some kind of disabilities which might be mild to severe. It also includes gastrointestinal abnormalities. So if you see here, the incidence of this Down syndrome, 1 in 750 of live birth can be seen, and also Down syndrome born to mother younger than 30 years of age can be seen mainly. So abnormalities involving sex chromosomes, including aneuploidy and mosaicism, are relatively common in general population. The most common sex chromosome abnormalities include Turner syndrome, Klinefelter syndrome, what I have already explained. So if you see here, these are when a human cell has a chromosomal number. If you see, human cell has 23 chromosomes, such as human ova or sperm. It is in the haploid stage after conception. In cells other than the reproductive cells, 46 chromosomes are present in the diploid stage. So if you see, trisomy is an example of aneuploidy, is the presence of 3 of a particular chromosome rather than 2. It results from unequal division called non-disjunction of chromosomes into daughter cells. So example, we can take here this Down syndrome, trisomy 18 and 13 also can be taken. So this is about the chromosomal disorders. Thank you.